Hi everyone, my name is Nguyen, and I'm a researcher at the University of Washington studying mental health in the immigrant and refugee communities. In this short talk, I will highlight some of the impacts that systemic racism has on the health of BIPOC communities. I want to start with this framework of social and structural determinants of health. It is well documented that our health outcomes are tied to the many social and structural layers that surround us, as you can see in this image. Our health is not only tied to our individual lifestyles, but it is also impacted by the social conditions. These are conditions where we are born, live, work, and play, as well as the larger societal level conditions, the cultural, economic, political, and historical context. These social and structural conditions are interconnected and form a web that influences a great many outcomes of our lives, including our health. So the impact of structural or systemic racism is not only felt in the specific arena in which the policies or practices are happening, but it is felt and experienced across the whole spectrum of life. We've been hearing a lot about structural and systemic racism lately. Let's look more closely at what we mean by systemic racism. Bailey et al. Define systemic racism as the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. These patterns and practices in turn reinforce discriminatory beliefs, values, and distribution of resources. So the racist policies and practices that take place within an institution are not only impacting that specific institution. These policies and practices get reinforced in other arenas, and they form complex and enduring values and beliefs, which become deeply embedded in our social, cultural, and political systems. And they help to shape the disparities and outcomes in our communities, including in employment, housing, education, and health. Let me share some of these outcomes. Let's look at unemployment rates by race. As you can see, BIPOCs have higher rates of unemployment compared to whites. Here are poverty levels. Again, we see that poverty rates among BIPOCs have been consistently higher than whites. African Americans are twice as likely to live below the poverty level than whites. In home ownership, we see that BIPOCs fall well below whites. And in terms of the impacts on health, while advances in technology and science have contributed significantly to our overall health, disparities continue to persist along racial and ethnic lines in the US. In infant mortality, African Americans experience a much higher rate of mortality compared to their white counterparts. In pregnancy related death, African Americans and Native Americans experience a much higher rate of mortality than other groups. Native Americans and African Americans have lower life expectancy compared to other groups. And Native Americans and Latinx have much lower rates of health coverage compared to other groups. In looking at the leading causes of death, across the board, we see that BIPOC communities bear much of the burden of disease, including mortality. For instance, heart diseases, the leading causes of death in the United States. African Americans have the highest mortality rate of any racial group. They bear much of the burden of risk factors, such as obesity and hypertension. In cancer, African Americans, again, have the highest cancer mortality rate of any racial group. Native Americans have the highest rate of lung cancer, and Asian Americans and Latina women have disproportionately higher cervical cancer mortality rates than other racial groups. And as we continue to face the pandemic, we are also witnessing the devastating ways in which it disproportionately impacts BIPOC communities. We are seeing in real time how white systems are failing BIPOC communities in this fight against the pandemic. BIPOCs are infected with COVID at a disproportionately higher rates than their white counterparts. And African Americans experienced the highest COVID-19 mortality rate nationwide. I know there's a lot packed in this short talk, and I look forward to our conversation to unpack some of these things and to exchange ideas on what each of us can do to confront systemic racism. Thank you.